How you doing? My name is Anthony Nolan. I want to welcome you to Rollin with Rep. Nolan. I have the great pleasure of being over here on Frontage Road in New London, Connecticut at UCFS. And some of you might not know what that is, but I have two special ladies here with me this afternoon that is going to help us understand and let the community know about UCFS. So ladies, if you could introduce yourself, and one you could start with, what is UCFS?
Sure. So welcome. Thanks for inviting us to do this today. We're always really proud to share what UCFS, which is United Community and Family Services, is doing in the community. My name is Jennifer Granger. I'm the president and CEO of UCFS.
And good afternoon. My name is Pam Kinder from UCFS Healthcare, and I'm the vice president of business development.
Well, I really appreciate you ladies taking the time today. And I just wanted to say, can you give an overview of UCFS?
Sure. So UCFS, our mission is that we strive to eliminate health disparities in the community. And we have been in operation as a nonprofit since 1877. So that's quite a long time, with a pretty singular mission for that period of time, I might add, yes. Which is to provide services to those who are primarily low income. We offer primary medical and dental services through our community health center program. We also offer community-based behavioral health services through our community-based program funded with grant funds from the Department of Children and Families, where we're out in individuals' homes working with kids and families for a whole variety of reasons, providing evidence-based therapeutic interventions. Mm-hmm. And then we also have an elder care program. So Sheltering Arms is a residential care home for the elderly located in Norwich, Connecticut. And co-located on that property is the Ross Adult Day Center.
Well, those are really the things that our community needs. And you said something about health disparities, which is a huge thing because we know there is a great deal of health disparities in the state of Connecticut, along with the rest of the world. But what are some of the things that you help with to combat the health disparities?
It's part of our mission. Every single day we're striving to reduce health disparities. From our facilities to the services we offer to the people we hire. So we try to make sure that people are comfortable and welcoming in our buildings. Mm-hmm. And then we educate. We try to make sure that people coming through our doors, even if they're there for an earache, we're trying to make sure that they understand the programs and services we offer to reduce those health disparities in particular populations or communities and people who walk through our doors. So it is, as Jen said, every single day we're striving to reduce those health disparities with members in our community, trying to educate people so they can further educate people on the services we offer, the programs we offer, and where they can find help.
And that's one of the most amazing things that I think that we can do for our communities is educate them, because you can never put out too much information so people understand, especially like your services. Can you be a little bit specific on services? Sure. I mean, because you mentioned mental health, you mentioned dental.
Right, right.
So
we provide, as a federally designated community health center, we have to provide comprehensive care, medical, dental, and behavioral health services. We do that through 5 outpatient locations throughout New London County and southern Windham County, as well as through 9 school-based health centers. And who do we offer those services to? Everybody is the answer. So we provide services across the lifespan. So from pediatrics through geriatrics. And we provide those services regardless of an individual's ability to pay. So we are focused on individuals who are who have lower incomes, but we also provide private insurance as well as a sliding fee scale for individuals who do not have insurance. As Pam mentioned, one of the benefits of coming to UCFS is not only the education, but the integrated care we provide. By offering all of those services at one location, you can come as a family and someone can have their teeth cleaned. Maybe someone can go have a gynecology service with our women's health provider. We can provide geriatric services to elderly in your family.
Yes.
We have ancillary services that are readily available on site, like pharmacies and laboratory services. So we're trying to make this as easy for families as possible to get everything they need in one place, whether it's those medical services, behavioral health, therapy for, we offer individual, group, and family therapy.
And I'm looking at some of your things on the
Art
wall here. So you have some
therapy.
art therapy. Can
We
you just
do.
give a little brief understanding? When people talk about art therapy, how does that work into healthcare?
Sure. So it's really a great modality to allow individuals to express what's happening inside through artistic expression. And they don't have to be an artist in order to participate in that. But as they move through therapy and they're able to express what they're feeling through these medium, it helps it helps get that out, and it helps to evolve their thinking and coping behavior through those services.
Wow.
And then we love to, as you can see, sort of display the outcome of that art. We have that throughout our centers. We love to post those things.
I think that's a necessary component to what you do when you share some of the artistic abilities of those who come. One, it makes them feel good, and two, it allows other people to kind of see that artwork, and they can probably or sometimes picture some of the things that go on
Absolutely.
with themselves, you know.
Yeah.
Exactly.
Outside of this room, there's a whole display, and we called it Reflections of Recovery, and it was patients who developed artwork.
Yeah.
And that was meaningful to them through their journey with their clinician, and it's wonderful. And they love to come and see it. They love to see where they were, and then at the end of their time with their clinician, to see how much they've benefited from the program.
Yeah. So for those that might watch and they don't know how to get in touch with UCFS or the web address, could you share how they can reach out to
Sure.
UCFS and what it's like when they call?
Sure. So at UCFShealthcare.org is our website, and it is a wonderful website that lists all of our sites, all of our phone numbers. So that's probably the easiest way, if you're sitting at home, the easiest way to get in contact with us. And depending on which health center you prefer to start your care at UCFS with, you would call that number. We have a patient solution center, call center, that would answer your call and give you the services and the appointment times that you need.
Okay. The process in which someone comes in, do they have to worry about bringing a checkbook with them, or is it?
No.
I mean, how do
No.
because people worry about healthcare,
Sure.
having to pay right away and stuff. So, what are the dynamics behind someone coming and not having to do that?
So we have a variety of, first of all, as I mentioned, our services are available regardless of ability to pay.
Okay.
So based on your income and family size, we are able to adjust your fee if you have no insurance. But our goal is to make sure that you're getting the benefits that you're eligible for. So we have a wonderful community outreach and support team who will work with you and your family to make sure that you are enrolled in any kind of insurance, private or public insurance for which you're eligible. And they will walk you through that process, help you through the application. Our staff speak multiple languages. For example, at UCFS,
That was gonna be my next
Spanish,
question.
English, and Haitian Creole is widely spoken in especially our Norwich community. So we have staff who are able to support everybody in those three languages face to face. But we also have access to Language Line, which has dozens and dozens of languages, and we have access to that to help support during those enrollment encounters. If we don't offer a service, if you need other types of support, like housing, like heating assistance, we have partnerships throughout the community with other organizations who do that work and for whom that's their specialty, like a TVCCA, for example.
And that's a good thing to hear, that you collaborate with other agencies or organizations, because a lot of our residents that stay in southeastern Connecticut are always looking for help with things sometimes that you might not provide, but to know that you have those collaborations in the community are really good. So there's mental health,
Correct.
dental,
Dental.
elder care. Can you touch on elder care a little
Sure.
bit? Because we have quite a few seniors in our community that might
benefit
hear about the
Yeah.
benefits that you have.
So in our outpatient medical center, we do have a geriatric specialty program where we have a geriatrician who sees clients on a weekly basis who may be referred by somebody who needs an assessment for maybe an early stage dementia or something like that. But our primary program that we're most known for is Sheltering Arms, which is a residential care home for the elderly. It houses up to 30 individuals at any given time, age 60 or older. And these are individuals who, for a variety of reasons, really can't or shouldn't live or don't want to live alone in the community anymore, but they're really not ready for a long-term care facility.
Right.
So this provides them with an opportunity to live with other seniors. There's a lot of activities and that we offer so that they are kept very busy. We provide meals. It's a medical model, so we provide nursing support to them for medication management. We provide case management, help them get to their doctor's appointments and things like that. So it's a really great homey environment for individuals to live. And we also, like our other services, cater to those who are at lower income. So people don't have to worry about they can't afford to go live in a nursing home. So we have a lot of, our staff are specialized in that and helping people qualify. On the same property though, we have the Ross Adult Day Center. So for individuals who need supervision during the day or whose family members may just need some respite time throughout the week, we provide transportation, or you can drop off and pick up a loved one at the Ross Adult Day Center Monday through Friday. And we can accommodate between 35 and 40 individuals any given day. And again, have lots of fun activities. We keep them busy. Mm-hmm. There's nurses that are there. We provide services like bathing and things like that for when they're there. We also have a clinic on site. If someone's not feeling well, we have a nurse practitioner who's there. So it's a really great program that complements our outpatient services as well.
Well, that's great. So comfort is a big thing when people come to facilities that provide healthcare. And I see out in your lobby area, there's kind of a comforting setting. Can you just share your thoughts on people that need that and how important it is?
It's very important. So I'm in charge of facilities. So it's very important to me, as well as Jen and our previous CEOs and senior managers. We wanted to make sure that our facilities are of the highest quality and presentable to anybody who walks through our door. So I've been at UCFS for 20 years. And when I first started, I had the opportunity to tour some other community health centers, and they were in disrepair. The furniture was mismatched. The painting was peeling off the wall, and we knew that that's not what we wanted. No matter your payer status, when you walk through a UCFS facility, it's going to be state-of-the-art, clean, and presentable, and make you feel welcomed and comfortable. And that's really, really important to us at UCFS.
Yeah. So obviously with all the pictures and things that you have, not that adults don't do art therapy, but that is something that I think would be very attractive to children in the ways that some of our children express some things. So I'm really glad about the art therapy, because that is a great avenue that I've learned in the career that I have been in that are easy for kids to express themselves. So
they might not be able to verbalize how they're feeling, but they can draw it.
Oh, yeah.
And, many years ago, we used one of the examples of a child, and their house had burned down, and their family was going through divorce, and their first picture was just this black crayon that they drew. And towards the end of their therapy, they drew a son and a house and a family. So this was over many, many months. But the child was able to express in art what he couldn't verbalize. And so I think it's one way that the clinician can work to make sure that the child is heard, even if it's not verbalized.
Yeah.
Yeah. And one of the other things is that it's important to us that individuals see themselves when they come into our facility. So you mentioned about being comfortable.
Mhm.
So we want people to realize that we are a place that respects diversity, equity, inclusion, that we have programs and services that will cater to a variety of their needs, whether it's anxiety or depression or diabetes, or whether they need oral health. We want them to understand and really feel that they're in good hands when they
Yeah.
walk into in our space.
Well, ladies, I thank you so much for spending this time on Rollin with Rep. Nolan to try and educate our community about UCFS. Is there any closing things that you might want to share that we didn't touch on?
If you have a question and you don't know where to turn, that's what we're there for. Give us a call. We'll be able to provide you services or connect you with one of the partner agencies or the agencies that we collaborate with to make sure that their needs are met.
Well, thank you so much.
Very good.
Ladies and gentlemen, you've heard it here on Rollin with Rep. Nolan, and we thank you for checking us out, and we wish you a great day.